and your physician, a respected man of medicine, tells you to lie back on the examination table, lifts your skirt, spreads your legs, and begins massaging your genitals with scented oils, until you climax violently on his table, while he takes clinical notes about your hysterical paroxysm. Now imagine this isn't some horrifying assault. This is prescribed medical treatment. This is what thousands of Victorian women experienced every single week for decades, and the most disturbing part: the doctors performing these procedures had absolutely no idea they were giving women orgasms. They thought they were curing a disease. This is the story of how medical ignorance, sexual repression, and misogyny created one of the most bizarre chapters in medical history, where respected physicians across Europe and America spent their days manually stimulating women to orgasm, and somehow convinced themselves it was just another medical procedure, as routine as checking a pulse. But here's where this story gets even more twisted, and why you need to hear the full truth. Everything I just told you, the story that's been repeated in dozens of history videos, university lectures, even Hollywood movies, might actually be a lie. Recent historians have torn apart the evidence and found almost nothing to support the claim that Victorian doctors routinely gave women orgasms as treatment. So what really happened? Was it all a myth? Or is there a darker truth hiding beneath the controversy? Because whether or not doctors were literally masturbating their patients, one fact remains absolutely undeniable. Victorian medicine treated women with such profound ignorance and cruelty that the orgasm story seemed completely plausible. And that alone should horrify you. The real history of how Victorian doctors treated women is somehow even more disturbing than the myth. Let me take you back to where this nightmare actually begins, not in Victorian England, but in ancient Greece, over 2,000 years ago. The physician Hippocrates, the father of modern medicine, whose oath doctors still swear today, looked at women suffering from anxiety, depression, insomnia, irritability, basically any symptom that didn't fit neatly into a box, and decided he knew exactly what was wrong. Their uterus was wandering around inside their body like a lost animal. I'm not making this up. Ancient Greek physicians genuinely believed that the uterus was an independent creature living inside women, and when women didn't get pregnant often enough, this uterus would get restless and start migrating through their body, pressing against their lungs, causing breathlessness, squeezing their heart, causing palpitations, pushing on their brain, causing madness. Plato himself wrote that the uterus is an animal within an animal, desperate to bear children, and when it remains childless too long, it becomes distressed and wanders throughout the body, blocking passages and causing disease. Think about the insanity of this for a moment. The greatest minds of ancient Greece, philosophers and physicians who laid the foundations of Western civilization, genuinely believed women had a mobile organ traveling through their torso like some kind of internal parasite. And the prescribed cure: get married, get pregnant, have sex, keep that wandering womb occupied and in place. This wasn't fringe medicine. This was mainstream medical theory, taught in the greatest schools, practiced by the most respected physicians, and it would dominate medical thinking about women for the next 2 millennia. By the time we reach the Renaissance, doctors had finally figured out through dissection that the uterus is actually anchored in place by ligaments and cannot physically wander around the body. You'd think this would end the hysteria diagnosis, right? But no, they just adjusted the theory. The problem wasn't a wandering womb anymore. It was toxic feminine vapors, an imbalance of humors, corrupted blood, nervous weakness. Basically anything that let them keep diagnosing women with hysteria while ignoring the real problems. Because hysteria was never really about medicine. It was about control. It was a convenient label doctors could slap on any woman who didn't behave exactly how society expected her to behave. Were you angry about being trapped in a loveless marriage? Hysteria. Were you sexually frustrated because your husband refused to pleasure you? Hysteria. Did you want an education instead of just popping out babies? Hysteria. Were you exhausted from having zero legal rights and being treated as property? Hysteria. The diagnosis was so conveniently vague it could mean absolutely anything. English physician Thomas Sydenham, writing in the 1600s, estimated that hysteria accounted for 1/6 of all human diseases, and was especially common in women. By the Victorian era, some doctors claimed that 3/4 of all women suffered from hysteria at some point in their lives. Now here's where we enter the Victorian period. And this is where the story gets truly demented. Victorian society was so sexually repressed, so absolutely terrified of female sexuality, that they created a medical blind spot so enormous that, according to one controversial theory, doctors could spend hours manually stimulating women's genitals to orgasm, and genuinely not understand what they were doing. The theory goes like this. Victorian medical textbooks taught that proper women had zero sexual desire. Dr. William Acton, one of the most influential physicians of the era, wrote in 1857 that the majority of women, happily for them, are not much troubled by sexual feeling of any kind. This wasn't just his opinion. This was accepted medical fact taught in universities across Europe and America. Victorian doctors genuinely believed that respectable women experienced no sexual pleasure whatsoever. Sex was purely for procreation. And any woman who showed signs of sexual desire was either a prostitute or mentally ill. The clitoris was barely mentioned in medical textbooks, and when it was described as a vestigial organ with no particular function. Many anatomy books simply ignored it completely. So when women came to their doctors complaining of anxiety, insomnia, irritability, muscle tension, symptoms we might today recognize as sexual frustration, and doctors saw only disease, and they prescribed a treatment that supposedly dated back to Roman physicians, pelvic massage to induce hysterical paroxysm. According to the controversial theory popularized by historian Rachel Maines in her 1999 book, The Technology of Orgasm, here's what would happen. A respectable married woman, let's call her Mrs. Elizabeth Thornton, would visit her physician complaining of nervousness and trouble sleeping. Her doctor would diagnose hysteria and explain that she needed pelvic massage therapy to restore her nervous system. She would visit his office weekly, lie on an examination table, partially undressed but covered modestly with a sheet, and the doctor would apply scented oils, lavender or rose were popular, and begin massaging her vulva with a circular motion. He would continue for anywhere from 15 minutes to over an hour until she experienced what he clinically documented as hysterical paroxysm, sudden violent muscle contractions, flushed skin, rapid breathing, copious vaginal lubrication, followed by deep relaxation and a temporary relief of symptoms. The doctor would write in his notes that the treatment was successful. The patient achieved paroxysm, symptoms temporarily relieved, recommend continuation of weekly treatments. Mrs. Thornton would leave feeling satisfied and relaxed for the first time in months, schedule her next appointment, and probably recommend her doctor to her friends, who were also suffering from hysteria. The doctor meanwhile would genuinely believe he had just performed a tedious medical procedure, complaining in medical journals about how exhausting it was, how his hand would cramp, how it sometimes took over an hour to achieve the necessary paroxysm. Some doctors wrote that treating hysteria patients was the most physically demanding work in their practice. Dr. Russell Troll, writing in 1903, complained that inducing hysterical paroxysm could take over an hour, and was the most tedious and demanding of medical procedures. Think about the cognitive dissonance required here. A doctor would spend his entire day manually stimulating women to what we now recognize as obvious orgasms, then go home to his wife, who he believed experienced no sexual pleasure whatsoever, and see absolutely no connection between the two. The medical blindness was so complete that they invented increasingly elaborate devices to make the procedure easier, without ever questioning what they were actually doing. By the 1880s, some doctors had turned to hydrotherapy, directing high-pressure water jets at women's genitals, while they sat in specially designed chairs with cutout seats. European spas in Bath, Baden-Baden, and other resort towns became famous for their hysteria treatments. Women would spend weeks at these luxury spas, receiving multiple water treatments daily, and reporting feeling wonderfully restored and invigorated. The French called it la douche pelvienne, the pelvic shower, and advertisements promised complete restoration of feminine vitality through the scientific application of thermal waters. But manual massage was still the most common treatment, and doctors' hands were getting tired. That's when physician Joseph Mortimer Granville invented the first electromechanical vibrator in 1883. He insisted it was only for treating male muscle disorders, and was horrified when other doctors started using it for hysteria treatment. But they ignored his objections because it was simply too effective. His vibrator could induce paroxysm in under 10 minutes, compared to an hour of manual massage. Within 2 decades, dozens of vibrator models flooded the medical market. The 1906 catalog from the Weiss Company offered over 20 different models for physicians. And here's where it gets absolutely wild. By 1900, vibrators became the 5th most common electrical appliance in American homes, sold right alongside toasters and sewing machines in the Sears catalog. The 1908 Sears catalog advertised a home vibrator as very useful and satisfactory for home service, with advertisements showing wholesome-looking women using them, technically on their faces and necks, but with text reading, "Vibration is life." The secret of the ages has been discovered in vibration. Women were buying these devices for home use, experiencing what they probably understood was sexual pleasure, even if they couldn't articulate it. And the medical establishment still maintained that proper women had no sexual desires. The level of willful ignorance required is almost impossible to comprehend. Dr. John Harvey Kellogg, yes, the corn flakes inventor, ran a sanitarium where he treated hysteria with vibrators, while simultaneously crusading against masturbation as a moral evil that caused insanity. He recommended applying carbolic acid to young girls' clitorises to prevent them from touching themselves. Yet he saw no connection between that organ and the hysteria treatments he was administering. This is the same man who invented corn flakes, specifically to be so bland they would suppress sexual urges, and he spent his days giving women orgasms with electric vibrators without recognizing what he was doing. Now here's where the story takes a crucial turn,
and here's where
and this
it
is
gets
what most videos
absolutely
covering
wild.
this topic completely miss. In 2018, 2 historians, Hallie Lieberman and Eric Schatzberg, published a devastating paper systematically dismantling the evidence for Mainz's theory. They went through every single source Mainz cited, and found that none of them actually described doctors stimulating women's genitals to orgasm. Not one. Mainz had misinterpreted general references to pelvic massage. which was a real treatment involving massage of the lower back and abdomen, and assumed it meant genital stimulation. She cited advertisements for vibrators being used as medical devices, but the ads showed them being used on faces, necks and backs, not genitals. Lieberman and Schatzberg concluded that there is essentially no evidence that Victorian doctors routinely performed what we would recognize as masturbation on their patients. The whole story might be a myth, a sexy Victorian legend that became accepted as fact because it fit our modern preconceptions about Victorian sexual repression. Maines herself has defended her work, but acknowledged that some of her interpretations may have been speculative. So does this mean Victorian doctors didn't do terrible things to women? Absolutely not. In fact, the reality is somehow even worse than the orgasm myth. Because whether or not they were literally masturbating patients, Victorian medicine's treatment of women was horrifyingly cruel, ignorantly misogynistic, and caused immeasurable suffering. Dr. Isaac Baker Brown, president of the Medical Society of London, performed clitoridectomies, surgical removal of the clitoris, on women and girls as young as 10 to treat hysteria, masturbation, and other behavioral problems. He was eventually expelled from the medical society, but not because the procedure was considered barbaric. He was expelled because he performed the surgeries without properly obtaining consent from the women's husbands or fathers. Other doctors cauterized women's clitorises with carbolic acid or silver nitrate to prevent masturbation. They performed hysterectomies, removing perfectly healthy uteruses to cure hysteria. They prescribed bloodletting, induced vomiting, forced bed rest for months, even years at a time, and administered dangerous drugs like laudanum, mercury, and arsenic. Charlotte Perkins Gilman, the author, was prescribed the rest cure by Dr. Silas Ware Mitchell, which involved complete bed rest, no reading, no writing, no visitors, nothing but lying motionless in a dark room for months. The treatment nearly drove her insane, and she later wrote, The Yellow Wallpaper, about the experience, a chilling story of a woman's descent into madness while being treated for hysteria. Victorian doctors institutionalized women who were too difficult to control, diagnosing them with hysteria or moral insanity, and locking them in asylums where they were subjected to ice baths, restraints, forced feeding, and isolation. Many women spent decades institutionalized, simply because they were inconvenient, because they wanted divorces, because they had affairs, because they were too independent or too sexual, or too anything that challenged Victorian ideals of passive, obedient femininity. The fundamental problem wasn't whether doctors were giving women orgasms. The problem was that Victorian medicine viewed women as inherently defective, ruled by their reproductive organs, mentally weak, prone to irrationality, and in constant need of male medical supervision and control. Every aspect of women's lives and bodies was medicalized, pathologized, turned into a disease that needed treatment. Menstruation was considered a monthly illness. Pregnancy was treated as a dangerous medical condition, requiring months of bed rest. Menopause was seen as the beginning of women's mental and physical decay. Even women's education was considered medically dangerous. Harvard professor Dr. Edward Clark published a best-selling book in 1873 arguing that higher education would damage women's reproductive organs because blood would flow to their brains instead of their uteruses, leaving them sterile and hysteric. Universities used this medical theory to justify excluding women from higher education for decades. Every time women tried to expand their rights or opportunities, doctors were there with medical theories explaining why women's weak constitutions and nervous systems couldn't handle it. So whether the orgasm treatments happened exactly as Maines described, or whether that story is partially mythologized, the core truth remains. Victorian medicine treated women with such profound ignorance, such systematic cruelty, and such complete disregard for their actual experiences and needs that the orgasm story seemed not just plausible, but almost mundane compared to the documented horrors. The vibrator myth has been questioned, but the surgical mutilation of women's genitals is documented fact. The pelvic massage to orgasm might be exaggerated, but the forced institutionalization of thousands of healthy women is absolutely proven. And here's what makes this history so relevant today. We're still dealing with the legacy of Victorian medical misogyny. Women's pain is still routinely dismissed as psychological or exaggerated. Women wait years longer than men for diagnosis of the same conditions. Endometriosis, a disease affecting 1 in 10 women, takes an average of 7 to 10 years to diagnose, because doctors don't take women's pain seriously. Medical research has historically focused on male bodies, treating women as smaller, more hormonal versions of men, rather than understanding sex differences in disease and treatment. The word hysteria might have been officially removed from psychiatric diagnosis in 1980. But the underlying attitude that women's complaints are probably emotional rather than physical, that women are unreliable narrators of their own experiences, that women's pain and symptoms are less legitimate than men's, those attitudes persist in medical practice today. Women are less likely to receive pain medication in emergency rooms. Women's heart attacks are more likely to be misdiagnosed because they present differently than men's, and doctors are trained primarily on male symptoms. Women of color face even worse medical discrimination, with black women dying in childbirth at 3 to 4 times the rate of white women in America. Not because of biological differences, but because their pain and concerns are systematically ignored. The Victorian doctors, who spent their days treating hysteria, whether or not they were literally giving orgasms, genuinely believed they were practicing good medicine, following the best science of their time, helping their patients. And that should terrify you, because it means that the medical establishment can be systematically wrong about women's health and sexuality, can cause immense suffering, and can do it all with the absolute confidence that they're helping. It means that future generations might look back at our current medical practices with the same horror and disbelief that we look at Victorian hysteria treatments. The story of Victorian hysteria, whether the orgasm treatments happened or not, is ultimately a story about power, about who gets to define disease, who gets to determine treatment, and whose experiences are considered valid medical knowledge. For centuries, women's own understanding of their bodies was considered less reliable than male doctors' theories. Women who said, "I'm sexually frustrated," were told, "No, you have a diseased uterus." Women who said, "I'm exhausted from having no control over my life," were told, "No, you have weak feminine nerves." Women who said, "This treatment feels sexual," were told, "No, this is purely medical." The Victorian hysteria story, myth or reality, resonates because it captures a truth about how medicine has treated women with ignorant confidence, with systematic dismissal of their actual experiences, and with treatments that serve to control and pacify rather than heal and empower. So yes, the specific claim about doctors giving women orgasms might be exaggerated or misinterpreted. But the broader story about Victorian medical misogyny, that's not just accurate, it's somehow even worse than the simplified version suggests. And recognizing that history, understanding how profoundly wrong medicine has been about women's bodies and sexuality, That's essential to making sure we don't repeat those same mistakes today. Because the ghosts of Victorian hysteria are still with us every time a doctor dismisses a woman's pain as anxiety, every time medical research excludes women's bodies, every time a woman is told her symptoms are all in her head. The wandering uterus theory might be dead, but the attitude that created it, the assumption that women's bodies are mysterious, defective, and in need of male expertise to interpret and control, that attitude lingers in ways both obvious and subtle. And until we fully acknowledge and dismantle that legacy, the story of Victorian hysteria, vibrators and all, remains horrifyingly relevant.